any patient comes, elderly patient, 60 plus, comes with complaining of urethritis and your UTI and also hesitancy and frequency of micturition. That can be inflammation and infection of the prostate, and also it can be enlargement. A patient when comes, you have to do a PR examination, Per Rectal examination. Now see, the index finger is put inside the rectum and you can feel the prostate. You can feel the prostate, you can feel the lobes of the prostate, and even you can see if any distortion in the anatomy of the prostate. In clinics, you do an USG, you will get it, the image. Now, why I want to stress is that in belly and love surgery, if the surgeon or any physician doesn't do a PR examination, that means the great toe will be put into his rectum. Why it is a joke? It's a joke. The great toe will be put in the doctor's rectum, because you will be losing clues and also missing many things. And this is a saying in the previous day of modern imaging. With this small note, I'll begin. Now you can see this is the rectum, this is the prostate gland, this is the bladder, this is the urethra, this is testicles. Now, again, this is another section showing this is prostate. When you put your finger to just in the rectal wall and the prostate, you just move your finger in clockwise direction and anti-clockwise direction. Of course, you have to take a lubricant. Nowadays, 2% xylocaine jelly is available. You lie the patient in left lateral position and you can examine. But the art of examining and putting your finger in the rectum, you have to bring the confidence of the patient and see the prostate. Another thing, in Ayurveda, in Shushruts, now from 2017, any proctitis or any piles, fissure, and any condition in the anorectal region, bleeding piles, prolapsed piles, that is examined in the lithotomy position. But when I am seeing this I have learned the art from Padma Shri Professor Manoranjan Shauji of BHU, who has again the iftar technique of Khar Sutra, where the sushut with, in those days, ghee or some oil is to take in the index finger and then put in. You can feel the whole of this anal canal and part of the rectum. Even you can feel the prostate. But in a even the patient has to any examination. You are examining a patient, the abdomen or anything. You have to bring the patient's confidence that no, you won't be harming this. Now this is the prostate. Situation, coverings, gross features, apex, base, surfaces, posterior surface, anterior surface, and infralateral surface, lobes of the prostate, structures traversing the prostate, blood supply, lymphatic drainage, nerve supply, applied anatomy. This is broad. In these, we'll be covering I told you, any organ you are studying, it will be in this pattern. The situation, the urinary bladder, here's the urinary bladder, pubic symphysis, ductus deferens, urogenital diaphragm, urethra, the penis, glands and fufuse, the epididymis, testes and scrotum. Now you can see the bulbourethral gland and the anus, and this is the prostate. The ejaculatory duct, the seminal vesicle, this is the seminal vesicle, ampulla of ductus deferens, the prostate gland and bulbourethral gland. This is now capsules of the prostate. The true capsule, thin fibrous sheet forming the outermost part of the prostate. False capsule, a fibrous sheath derived from the pelvic fascia and continuous with anteriorly puboprostatic ligaments, posteriorly rectovesical fascia, on each side of the prostate. The true and false capsule are separated from each other by the prostatic venous plexus, which receives the deep dorsal vein of penis. The capsules of the prostate, it is schematic drawing. Now the urinary bladder, you can see the lateral puboprostatic ligament, the venous plexus in blue, the prostatic urethra, this is the true capsule, and this is the false capsule. This is the true capsule and false capsule. In between the true and false capsule is the venous plexus, prostatic venous plexus, where the dorsal nerve of the dorsal vein of penis goes into. Now, gross features, apex, base, surfaces. This is the base, this is apex. Now, surfaces, anterior, posterior, introlateral. Anterior, posterior, introlateral. Now, coronal section of the prostate is the coronal section of the prostate, is the mucous membrane of the bladder, the visceral pelvic fascia is the levator ani in the muscle. You just see, you take when you are studying the prostate, you see the pelvis of the human body. Also, if you want to take an articulated pelvis. Articulated pelvis. And this is the prostatic venous plexus, this is prostatic sinus, the prostatic urethral crest, this is the openings of the prostate glands, this is the openings of the prostate gland, prostatic venous urogenital diaphragm, this is the urogenital diaphragm. The uterus, when you read the uterus, I told you the other day, the supports of the pelvic diaphragm. Now, others, and the fascia, ligaments, and that's holding the organ. And the fat and connective tissues, that's a packing material. Now, any gift coming from Amazon or Flipkart, you see the packing. A small locket on Valentine's Day, the parcel is so big, but it's a small that is packed, and so there is no trauma. And this is the uniqueness of the human body. Now, lobes of the prostate. See the medial lobe, the prostatic ventricle, the ejaculatory duct, the posterior lobe, the anterior lobe, the urethral crest, prostatic sinus, opening of prostatic ventricle, opening of ejaculatory duct, openings of the prostatic duct, lateral lobe. Now, the prostatic urethra, lateral lobe and posterior lobe. You please just draw diagrams and sketches. When you are reading from your book or tab, you make this thing. Don't, in the tab or your Apple, you are doing sketches or something like that. But that doesn't remain. You can demonstrate, or when you are studying with tab or any electronic gadgets, then you are marking arrows and this thing and you're enlarging things. Don't literally waste time. Khata le lo, side book, you have the downloaded image of the prostate to get better vision, but you concentrate on straight line drawings. Okay? Anterior lobe, posterior lobe, medial lobe. These are two lateral lobes. Now you can see the medial lobe, the ejaculatory duct, posterior, structures traversing the prostate. Now you can see the different duct, the seminal vesicles, ejaculatory duct, see the corpus cavernosum of the penis, the urethra proper, corpus spongiosum, and this is the glans penis. Now these are the testes, epididymis, scrotum in this. Now you can see it is going the arrow, you follow the arrow and it comes here. Now, when the seminal fluid coming, then the prostatic glands, they secrete that helps the seminal fluid to be ejaculated. Prostatic urethra. Prostatic urethra. Oh. Now, prostatic urethra, prostatic ejaculatory duct. Now, arterial supply, inferior vesical artery, middle rectal artery, internal pudendal artery. Inferior vesical artery, middle rectal artery, internal pudendal artery. Now, prostatic venous plexus, a venous plexus around the prostate gland receiving the deep dorsal vein of penis, drains through the vesical plexus and the prostatic veins. Yeah. This is a picture taken from Gray. See, these drawings, they are so unique. You see the old Grays, you download, you will see this. It is really how much time, pain, and they have taken to illustrate. Medical illustration has a different place, and in modern times, Netter's job, he's a Dr. Netter, Professor Netter. His job was he given us big room, studio, and only he used to illustrate, drawing his whole career and some few volumes of Netter's Atlas. Now it has become small. Now, small means in the content it's not small, size. Now, prostatic venous plexus, the deep dorsal vein of penis drains into the internal iliac. The prostatic venous plexus drains into the prostatic venous plexus drains into internal iliac veins, then to the inferior vena cava, IVC, which may explain the metastasis of prostatic cancer to the heart and lungs. So, this through the venous drainage, the prostatic cancer metastasis in the heart and lungs. Vertebral venous plexus, which may explain the metastasis of prostatic cancer to the vertebral column. The prostatic venous plexus receives the dorsal vein of penis and numerous vesical veins and drains into the internal iliac veins. Lymphatic drainage, nerve supply, prostatitis, benign hypertrophy, senile atrophy, carcinoma of the penis, prostate, and prostatectomy. The removal of the prostate. Now, malignant tumor of the prostate, male urethra, prostatic part, membranous part, spongy part. See the urethra. Prostatic part of the urethra, length and course, features, urethral crest, follicular seminalis, prostatic utricle, opening the ejaculatory duct, prostatic sinus. Now, the openings of the prostatic ducts in the urethral sinus. This is the urethral crest. Now, prostatic sinus is a cut open. membrane is part of the urethra. Symphysis, pubis, urinary bladder, prostate, prostatic uterus, prostatic and membranous part of the urethra here. Prostatic and the membranous part. The interbulbar fossa, bulb of the penis. Now, this is the penile part of the urethra and navicular fossa. There can be strictures in different levels in the urethra and see the features, two dilatations, urethral gland and urethral lacunae. Sphincters of urethra, internal urethral sphincter, external urethral sphincter, blood supply, inferior vesical artery, middle rectal artery, internal pudendal artery, lymphatic drainage, sympathetic fibers, parasympathetic fibers, somatic fibers. Urethritis, hypospadias, epispadias. This is epispadias, this is hypospadias. Now watch your thoughts, they become words. Watch your words, they become actions. Watch your actions, they become habits. Watch your habits, they become character. Watch your character, it becomes your destiny. Study, study. My only one appeal, you have 6 months. Joy, hope, joy, hope. Don't panic, please don't panic. I don't wear a mask because of fear. The child gets fear without gown and everything. I give them lollipop or some, and promise them an ice cream or some other sweets. And simple hernioplasty. Simple hernioplasty. Okay. Now you can see what I want to stress. Doctors means some powerful and people fear. Even when they are telling their story of their disease, they fear actually. At a psychological block হয়ে যায় আরেকটা কি তোমরা সব ভগবান ডাক্তাররা ভগবান তো এই ফিয়ারটাকে কমাতে হবে not only for surgical practices but you have to in your day-to-day practices and he's such a talkative guy. He was in class 2. Talkative means jada, and my OT sister, she is talking to her. Then you have to be gentle and see, you have to know your anatomy and the structures you are cutting through. And also, the main thing is spermatic cord. You have to take care, separate the sac, and slowly I am dissecting out. See, some of you might go to the army, join as a medical officer. So in the remote hills of Ladakh or Darjeeling or anywhere, border, then emergencies, not only I'm saying operations, but I'm talking about any wound, big wound, cut, you just infiltrate 2% xylocaine and you suture, debride the wound. This, and you have to practice and assure the patient, it might be a PV, it might be this thing. The first day any child comes to my chamber, I start dancing. Hey, Najbito. And I start to bring the patient into my confidence. Even later on, I will be showing you. I'm trying to make a total folder different. How I'm handling children. And even if it is a trauma, I take in the mother also, or any child that is close to his father or mother. And then she holds the child, or we lie the child in the thing, and the mother or the grandmother or the father sits on a stool, and then he just pampers the child and the chocolate he put. But at times he gets frightened. But slowly, by that time I put in the local anesthesia and proceed. Like in this period, the Muslims have this thing for circumcision. And the circumcision is a religious practice of the Muslims. And sometimes what happens, they don't suture. So suddenly if there is some bleeding is there, it just last week I did. So I took the, I think his grandmother. I made us made everything ready and gave 2-3 stitches, and it was okay. Now, this portion, the fundus, was attached to the testis. It was continuous with the testis. It didn't contract. And see, what I did is that I tied a ligature and snipped off. This is with the testes. Okay. Now over here in the deep ring, I am ligating, and this herniatomy. We don't go for hernioplasty because it will be as the child develops, it doesn't recur actually. Hey, yeah? Avinash, আরেকটা আছে, এটা 1 নম্বর হলো, 2 নম্বর। Now I'm closing one by one the walls of the inguinal, external oblique, internal oblique. My assistant was a homeopath doctor, but he died of heart disease, heart attack, because he was a diabetic. But he was a champion assistant. I miss him very much. The interesting thing that when I was come to the end of the operation, I just joked with him, "Hey, tor biye debo. I will marry you off. I will ask from your in-laws to give you a motorbike? He answered, no, 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 no. You have to give me. That this is the things that happens in my operation theatre. Now we have come to the last stage, and actually the dressing will be done with honey. Just honey soaked in gauze and